Tell us what it is about the hamate bone. Where is it, and why does it affect the swing of a hitter like Stanton?
It's actually, Nicole, one of the small bones of the wrist, but there's a little hook-like projection on that bone that sits in the base of the palm on the pinky side. So this is not an uncommon fracture in hitters because the end of the bat, kind of where they rest the bat in their palm, will often shear over that bone repeatedly. And if you can imagine the type of force that gets put through the bat, especially when you consider a hitter like Stanton, over and over again, it can sometimes shear off or essentially result in a fracture of that hook of the hamate. And we saw Stanton in pain last night with the swing, probably when he felt the break. And then what they do, if you have a fracture, the most common procedure is to go in and remove or resect that tiny piece, that hook that has fractured off.
Yeah, Stanton went 0 for 4 last night with 3 strikeouts. He said it was something that he felt early in the game, and it got progressively worse throughout the night. Now, Tim Kirchin was with us just a bit ago, and he said he's out 4 to 6 weeks. In that time frame, he's going to have surgery. Tim called it minor surgery. What exactly is it?
The procedure itself is not particularly complex. As I mentioned, this is a fairly common fracture in hitters. So they go into the palm and remove that little piece that has fractured off. The challenge for a hitter coming back is it can be quite tender in that spot. And again, they have to get accustomed to the bat resting in that position and being able to deliver the swing. So there's a matter of the healing, the wound healing, and then getting back into a comfort level of gripping the bat. It's not unreasonable to think he can do this in that time frame. We have examples. Pablo Sandoval, a switch hitter, actually broke the hamate bone in one hand one year and in the other hand the following year. He missed 45 days the first time, 37 days the second time. So it's individual, of course, but that is a reasonable time frame.
Tim Kirchin also made a comment to us about, in terms of healing, that this is the kind of injury that, yes, like you said, you can return 45 days, 37 days, 4 to 6 weeks, but it might be the kind of thing that sticks with you sort of throughout the rest of this season. What sort of lingering pain could come with this injury?
It really depends on how he develops scar tissue, because anytime you have surgery, you can get scarring over the area, and that can become a little bit sensitive. So again, that varies from one person to the other. But unlike wrist injuries that are in the joint, where sometimes you really lose power, and you'll see players struggle for months and months with their power return, that's not usually the case following a hamate procedure. It may be difficult for the first few weeks, again, until they get completely comfortable with their grip. But after that, and with a guy like Stanton, I think he has a chance to come back this season and to actually come back in good form before the year is out.